It was really a very tough journey for me.
Rodolfo de Lauta Lastimosa Jr. works 3 different nursing jobs in Toronto, but before he could work those jobs, he played the same kind of waiting game faced by many internationally educated healthcare workers trying to get their Canadian credentials.
It's very different here in Canada because they are very strict, really have to follow certain protocols and policies. But in terms of skills, it's quite similar.
Lastimosa says he needed to find different work while waiting 6 months for his license.
I was able to take my RPN exam, and luckily I passed it. The only one that's very realistic for me to work is as a caregiver. So I work as a full-time caregiver to an elderly male client.
We are missing a very skilled workforce that could contribute, and they can't right now.
As BC hospitals are still struggling with short staffing during the Omicron wave, Dr. Elizabeth Saywick at UBC Nursing says internationally educated workers are untapped.
The process for actually evaluating and vetting internationally educated nurses takes way too long. It is way too slow. So they don't want to have people who don't know how to provide care. The problem is that the system of those checks and balances is actually really understaffed.
Nursing schools, including BCIT, have created programs to give frontline workers fast-tracked COVID-19 specific healthcare training. But the director of UBC's nursing school says there's only so much schools can do to address hospital staffing shortages.
No, I'm sorry, but would you really want someone who has had an accelerated process that's too accelerated, so it's just like quick throw people into this? No.
A week ago, we asked BC's Ministry of Health if they were finding ways to speed up the process for internationally educated healthcare workers. We also asked if and how students are being fast-tracked in healthcare programs to get them into the workforce sooner. The province has not yet responded to our request. In Vancouver, Kier Junos, City News.